Today we're going to study headache. While studying headache, when the patient comes to you, you have to check the patient. First thing you have to check for the patient is his high CT, intracranial tension, and for that you need to do the fundus examination of that, in which you can see a very distinct feature of papilledema. If this is present, then it's a very dangerous condition for the student, and this headache is not a normal headache, it's a secondary headache at that situation, and for that it is known as dangerous headache when it is turned into a secondary headache. But first we're going to study the primary headaches. So turning ourselves over here, first we're going to study the primary headaches, in which we can see first type is tension type headache. That is one of the most common cause of primary headaches. And secondly, we're gonna check in the primary headaches about the migraine. It's a very important discussion topic. We're gonna deal it with in much more detail in the later part of the video. And then the third type of primary headache, which is trigeminal autonomic cephalgias. It is the most common type. From it is the most common type from trigeminal autonomic cephalgia is cluster headache. A cluster headache is also known as suicidal headache. It's a very important point. And then now we're gonna check what are the classification of secondary headaches. First of all, we get systematic infection that causes most of the secondary headache. It's the most common type. Then we get head injury, and the head injury is like you can see in head injury that very characteristic feature that you can get in head injuries are like thunderclap headache. It's one of very important thing, and it can be seen in subdural hemorrhages. And the other reasons are brain tumor, vascular. The other reasons are brain tumor, vascular disorders, and head injury. So all these comprise we're done with this head injury. So now we're done with the classification. Now we'll move to further discuss the tension type and migraine headache in detail. So now we're gonna continue our discussion on the headache. We have to discuss two types of headaches and for right now in detail. First is tension type headache, and second is migraine headache. In tension type headache, we can see that it is more common in female, and more than one third of the cases are from depression. And second, and then we can see it doesn't affect the sleep of a person, and we can see the vomit. If we can see in tension type headache, there is no vomiting, photophobia and phonophobia seen in the patient, and it doesn't affect the normal life of a person also. The main characteristic feature that we can see in tension type headache is pressure band over the head. This is the main feature of the tension type headache. Moving to the treatment of this, we can see we have acute and chronic cases of this. In acute case, we can give NSAIDs. And in chronic case, we can give amitriptyline. And for migraine, now we'll discuss migraine. For migraine, we have two types. One is classical, that accounts for 20% of the cases, and then we have common, that accounts for 80% of the cases. The main different feature between both of these is presence of aura. In classical, aura is present. In common, aura is not present. And what is aura? Aura is the normal perception of a person in his own space. So in this migraine, we can see a zigzag type of visual aura most commonly, and it can last long up to 1 hour in most of the cases. And in migraine, we have symptoms like vomit, photophobia, phonophobia. They're all present, but they are not present in tension type headache, as we have seen before. And the one attack of migraine can last up to 4 to 72 hours, and the patient also prefers to be in quiet room. Triggers of it can be alcohol and sleep deprivation. Further, we can see in lethargy in patients with migraine after the attack for 1 to 2 days, and to diagnose it we need at least 5 to 6 cases of common migraine to happen to confirm about the migraine. And for classical, we need one that has aura in it, that are presented with aura. We need 2 cases at least to confirm it is migraine. And for paracetamol plus antiemetic drugs like metoclopramide we can give. For moderate to severe cases we can give triptans, and for very severe cases we have to give soma, triptan 6 mg, and for prophylaxis we can give propranolol. For this, our discussion for headache is concluded. Thanks for watching.